Okay, so the last cluster of disorders we're going to talk about prior to the next exam is trauma and stressor-related disorders. In the DSM-5, there are 5 disorders that fall into this category: adjustment disorder, acute stress disorder, post-traumatic stress disorder, reactive attachment disorder, and disinhibited social engagement disorder. But for this class, and for the sake of time, I'm just going to have you focus on 3 of them: adjustment disorder, acute stress disorder, and post-traumatic stress disorder. And that's not because reactive attachment disorder and disinhibited social engagement disorder aren't really important and also interesting, but just because I want to make sure you're able to focus in on some of the more common disorders and gain a bit more depth rather than just breadth. Now, one thing to note about all of the disorders that fall into this category of trauma or stressor-related disorders is that they're unified by the diagnostic requirement that the person has to have been exposed to a traumatic or stressful event. And this is pretty unique in this cluster of disorders because, as you've probably started to notice, none of the other disorders we've covered stipulate a cause of symptoms, but these do. With that said, though, it's important to remember that experiencing a trauma or being exposed to a stressor does not necessarily mean that a person will experience a trauma or stressor-related disorder. There are a host of individual and systemic factors that affect whether or not a person reacts to a stressor or a trauma in a way that's diagnosable. And unfortunately, we still know little about what causes one person and not the other to develop trauma or stressor-related symptoms. But a person cannot be diagnosed with a trauma or stressor-related disorder unless they have been exposed to a traumatic or stressful event. So there has to be a specific and identifiable precursor to the symptoms. So let's start first with adjustment disorders. Adjustment disorders involve emotional or behavioral symptoms that result from an identifiable stressor. And the stressor can be one single event or multiple events, and the stressor can be acute or it can be chronic. Although the data on the prevalence of adjustment disorders are fairly inconclusive, recent estimates suggest that about 5 to 20% of the outpatient population and about 50% of inpatient populations meet diagnostic criteria. And research has further found that adjustment disorder can be found across all cultures, sexes, and ages. Now, part of the reason for the large spread in prevalence rates is that it's not uncommon for clinicians to use adjustment disorders as preliminary diagnoses in at least the beginning of treatment and then change to other diagnoses once additional background information has been shared or symptoms persist. So here are the diagnostic criteria for adjustment disorders, and we'll go through each of these points one at a time to try and break them down. So first, in order for someone to meet diagnostic criteria for an adjustment disorder, he or she has to develop emotional or behavioral symptoms in response to an identifiable stressor. And in the DSM-5, these symptoms are pre-specified as falling into one of several categories. When we say adjustment disorder with depressed mood, we mean exactly what you might think. So symptoms of moodiness, tearfulness, or feelings of hopelessness in reaction to an identified stressor. Adjustment disorder with anxiety would be marked by symptoms like nervousness, worry, jitteriness, or separation anxiety. Mixed anxiety and depression is exactly what it says, a combination of depression and anxiety. While adjustment disorder with disturbance of conduct would be appropriate when the person's symptoms are predominantly comprised of misbehavior. Some people's symptoms also look like a combination of emotional symptoms like depressive symptoms and/or anxious symptoms alongside behavioral symptoms. And then adjustment disorder unspecified is reserved for individuals whose maladaptive reactions or symptoms are not classifiable as one of the other specific subtypes of adjustment disorder. Next, the diagnostic criteria specify that these symptoms have to develop in response to an identifiable stressor. But what's important to note is that the identifiable stressor can be anything. It doesn't matter what type of stressor the person experiences, and it doesn't matter whether you believe the stressor is significant enough to warrant a clinically significant reaction. The only thing that matters is the client's reaction to that stressor. The final piece of this first diagnostic criteria is that regardless of the stressor and regardless of what type of emotional or behavioral symptoms the person experiences, the symptoms have to begin within 3 months of the onset of the stressor. Now, the question always comes up about how this time frame works if the stressor is chronic. So, for example, if someone has the stressful or traumatic experience of losing their house and becoming homeless, and they remain homeless for 6 months, do the symptoms have to start right away, or how does that work? And the answer to that is that according to the diagnostic criteria, as long as the symptoms started within 3 months after the person lost their house and became homeless, then they would meet diagnostic criteria. The next diagnostic criteria specifies that the symptoms or behavior the individual experiences must be clinically significant. And as with all other types of disorders, when we say clinically significant, what we mean is that the client experiences either marked distress that is out of proportion to the severity or intensity of the stressor, taking into account the external context and the cultural factors that might influence symptom severity and presentation, and or that the person experiences significant impairment in social, occupational, or other areas of functioning. And so what this means is that if the stress is either what might be expected given the situation and or does not cause significant impairment in functioning, then a diagnosis of adjustment disorder is inappropriate. The diagnostic criteria further stipulate that the stress-related disturbance does not meet the criteria for another mental disorder and is not merely an exacerbation of a pre-existing mental disorder, and that the symptoms do not represent normal bereavement. And finally, in order for symptoms to be classified as indicative of an adjustment disorder, they have to resolve within 6 months after the stressor or its consequences have terminated. So what this means is that if the symptoms persist for more than 6 months after the stressor ends, then adjustment disorder is not the appropriate diagnosis, and instead, the persistent symptoms, whatever they may be, should be used to make a proper diagnosis. So those are the diagnostic criteria for adjustment disorders. In the next video, we'll go on to talk about acute stress disorder and post-traumatic stress disorder.